My name is Paul Hiltz. I'm the CEO here at NCH, and we welcome you today to our hospital. And at the same time, we wish that we weren't even here today for this press conference, but the recent news of 2 tragic drowning deaths, along with 3 additional non-fatal drownings just in the past week, has placed a somber but urgent emphasis on the NCH Safe and Healthy Children's Coalition. Since its inception in 2010, the NCH Safe and Healthy Children's Coalition has focused on reducing the incidence of drownings in our community. And thanks to all of you that are involved in that and their work, we've seen a reduction in pediatric drowning tragedies, but more needs to be done to remind our community about the importance of water safety. And that's why so many supporters and community organizations like you are here today to send an important message to our community regarding drowning prevention. So thank you to the coalition and all its members for what you do to ensure that Collier County residents and visitors in this great community are safer around the water, because together we can prevent another family from being affected by this tragedy. And so now I want to introduce Captain James Cunningham, Collier County Sheriff's Office and NCH Safe and Healthy Children's Coalition Treasurer.
Thank you. Appreciate that. Once again, thank you all. Thank you to the media, and thank you to all of our partners that have come here. Once again, as Mr. Hilt said, not on a positive occasion, but obviously we can make tragedy turn into something more positive. And that is what we're looking to do today. It is with sadness that not only do we have the 2 drownings just in the last week, obviously last Saturday in Ave Maria, and just prior to that, a father drowned trying to save his child from a pond, again, right here in Collier County. Not only do we have the 2 deaths, but in addition to that, there were 3 other non-fatal drownings that are also impacting those families and loved ones that have to work through those 5 incidents. Not only is the individual families, and obviously our deepest condolences and thoughts are with those families and all that are impacted, but the community as a whole has really felt the impact of what has happened, because so many people were there physically present when the actual event happened, whether they stepped in to do CPR or whether they tried to be the ones to call 911 and get other resources. Obviously, this is something that's reverberating throughout the community. It's important to mention why the coalition is here, because if you understand how, when we were established in 2010, we had a mission to facilitate and implement programs to combat childhood obesity, prevent childhood drownings, and reduce sudden infant deaths. Recognizing that accidental injuries and the health and safety issues require a coordinated approach. And as you see by the people standing around this podium, there are more than 70 child-serving nonprofit or government entities and business partners that have joined together to establish the coalition that's been here for the last 14 years. And NCH and all of your staff, we sincerely appreciate the creation of the NCH Safe and Healthy Children's Coalition here specifically for Collier County. The coalition provides these organizations a conduit to bring programs and services together that face issues and identify solutions as a team. Thanks to the wonderful work of all the board members and all the partner agencies and organizations that are with us, we can and will be a water safer community. And we've seen a significant decrease in the number of pediatric drownings over the last several years. However, this past week is a reminder that we still have much more work to be done. So it is my honor and privilege to introduce Dr. Debbie Shepard. She's not only a member of the coalition, but she's the chair of the NCH Pediatric Department. Debbie, or Dr. Shepard, please come forward.
Thank you. As a general pediatrician, I just want to remind people that drowning happens to the best parents and the best people. It is silent. It is preventable. Drowning is fast and silent, and it can occur in under a minute. So it's something that really has to be, we have to be very aware of. We have to realize that 70% of toddler drownings happen during non-swim times, and it can happen to anyone, as we said. As a general pediatrician, I consider myself and my colleagues, like Dr. Anzalone with Healthcare Network, on the front line of prevention. In my office, this starts with the newborn visit or even at the prenatal visit when I assess the water access near their home. I ask them about whether they have natural bodies of water or pools off their home. And with that, we then talk about the layers of prevention. In that, the first is supervision. There is no substitute for active supervision around the water. Even when there are several adults, as there have been in multiple drowning incidents, we want one person to be solely responsible for each child. With that, we also want to make sure that we have people who are aware of their role. And so I am wearing a water watcher tag, and anyone in the audience who's wearing that would be great to show. And that designates you as someone who is not to be drinking or eating or on the phone or socializing. Your one job is to have your eyes on the water. We also want there to be actual contact with non-swimmers within the water, and that's really important. We talk about if you do lose contact, we also want to make sure that children are wearing bright colors, because once they go under the water, it can really blur. It can be really scary. If you've seen any of these photos, any kind of blue or green can just mesh. So people wonder, how did this happen? Once they go under, it can be a blur. So red, orange, fluorescent yellow, all of those are great colors to have around the water. We also talk about barriers. And that's actually something that why I mentioned that in the newborn visit is I want those barriers up quickly, because the mobile children, they can sneak out of sight very quickly. And so with that, we talk about having a barrier between the body and water in the house. We talk about door alarms. And if we don't have an active fence on there, then the door alarms can at least help. And Paula, are you going to buzz the alarm or no? No. We weren't going to scare everybody with it, okay? But door alarms. And I also remind parents that they also should have alarms on their screens, their lanais, so that they don't get to the canal, they don't get to the pond. And these can really get everybody alerted. I promise. I had one at my house. We also know that pool fences are 90% effective in preventing drowning. So having a pool, having a gate, having something that is locked, and I also encourage my families with older children to have an actual padlock so their older child can't open the gate, can't open the fence, and also making sure there's nothing in the pool to attract the child toward the pool, no toys in the pool, that the older child is not going to climb over the pool and start an avenue. And obviously, our first and foremost, again, is supervision. If we're supervising, hopefully we're going to be in there and stopping all of this, but we have to have the layers that we're talking about. And then finally, swimming lessons. And I'm very grateful for the number of entities here who provide swimming lessons. And we have made it our mission also to provide swimming lessons to those who have a financial need. So please check the Coalition website, and there are some resources there. The AAP has changed their recommendations. Back in the day, it was recommended that swim lessons not start until age 4, and now we know children can and should be taught to swim at age 1. So we pediatricians are actually talking about swim lessons at that age. It doesn't necessarily drown-proof a child, so that's why all of these layers are important. And then finally, if they're not experienced swimmers, to have the life vests near the water. We're very fortunate for the flotilla, Dan White, who has been instrumental in providing life vest stands on the beaches so that our children have access to a life vest. So all of these things were also born out of troubleshooting when we have had a drowning. And so I can't say enough about this coalition and how important it is to our community and to me as a physician and as an individual in this community. So with that said, I'd like to introduce George Aguilera, who's the Deputy Chief of the North Collier Fire Control.
Good afternoon, everyone. I'm here speaking on behalf of Fire Chief Eloy Ricardo, which is also on the board of the coalition. I want to echo Mr. Hiltz's initial comments. I wish we were not here. I mean, this is one press conference I would love to miss. But unfortunately, we are here. Since 2010, Collier County has had 53 drownings. We've now updated that number to 54. According to DCF, we've had 47 drownings in Florida since the beginning of 2004. If you pay attention to this table over here, there's roses, and those roses are for the number of children in respect and in honor of them. But think about this, 47, and we're not even halfway through the year yet. Staggering. For 20 years, from 1999 to 2019, the United States childhood drowning rates were steady and even showing a slight decline. Since the beginning of the pandemic, childhood drowning is once again drastically climbing. The center, and this statistic comes from the Centers of Disease in a report that they released on May 24th of 2024. Drowning is the single leading cause of death for children to ages 1 to 4. Think about that. It's not accidents, it's not car accidents, it's not poisoning, birth defects, it's drownings. The burden of childhood drowning doesn't stop at the age of 4. Drowning remains the second leading cause of injury and death for children between the ages of 5 and 14, with disparity between the African American and black children. At 15 years old, those numbers even start to skyrocket even higher. So this is a pretty drastic problem that we have. Alarmingly, recent reports show a dramatic increase in drownings. Nationwide, from 1 to 4 year old, we saw a 28% increase. In African American, we saw another 28% increase. And then a number that we haven't really talked about is older adults or adults 65 to 74. We saw another 19% increase in drownings. It is estimated by the CDC that 40 million adults do not know how to swim. CDC also estimates that for every one child that fatally drowns, another 7 or 8 are seen in the emergency department for a non-fatal submersion injury, 30% of which requires further hospitalization and treatment. That is compared to less than 10% of the other unintentional injuries. So again, it's a huge problem. Drowning is a silent epidemic that doesn't just lead to fatal outcomes. It can also leave a child requiring round-the-clock care for the rest of their lives. CDC now reports that the drowning cost on the U.S. economy exceeds $50 billion a year. We must continue to educate on water safety awareness and emphasize the layers of protection. One of these layers of protection Dr. Shepard just mentioned was young children and inexperienced swimmers need to wear a Coast Guard-approved life jacket, not water wings. Our coalition has 15 Childs Don't Float life jackets due, life jacket loaners in stations in Collier County. The North Collier Fire and Rescue Department, along with the U.S. Coast Guard Auxiliary Flotilla 93, 95, and 96, check the stands weekly to make sure they're in good condition to help keep children in Collier County water safe. If you imagine the numbers that are lost nationally, we can lose up to, and just imagine this, 11 school buses worth of children to fatal unintentional drownings per year. And if you think about it, that each bus has about 80 kid seats, that should set in. Drowning deaths in the U.S. were on the decline for decades, and this is the closing statement. We need to get back to when we were seeing that. This drastic increase has to stop, and it stops with work of the coalition, stops with work of the community, and all the partners that are associated with it. So with that, I'd like to introduce Tracy Bowen, which is from the Collier County Public School System. Tracy?
Thank you, Chief. Thank you for the opportunity to share Collier County Public Schools water safety education and drowning prevention initiatives. The Florida Department of Education includes 1 to 2 standards for elementary grade level surrounding water safety and swim skills. Our schools include water safety topics through quarterly health education opportunities and physical education courses. Here are some district and coalition program highlights. CCPS PE teachers cover all water safety lessons aligned with American Red Cross and Whale's Tales. We honor water safety through a themed Spirit Week surrounding the May 15th International Water Safety Day. We offer Stewie the Duck pre-K presentations, and our lovable mascot here joined the Coalition's drowning prevention efforts in 2016 to focus on preschool water safety through 2 safety tales called Stewie Learns to Swim and Swimming Lessons with Stewie the Duck. You'll see one of those here. There's a free interactive app with books and sing-alongs to help children and parents with practicing these key concepts that both my 5-year-old and myself still sing. Students enrolled in PE in grades 6 through 12 receive responding to emergencies, CPR, AED, and first aid practice each year. CCPS is in its 2nd year in a row for receiving the Red Cross Award for the highest number of student CPR certifications in the state. All schools are provided the water safety and injury prevention flyers with interactive information for parents in all school welcome areas. You'll also see them around here. Our first in-school Swim Central program was piloted this year at Avalon Elementary for all 5th grade students, as well as at Lorenzo Walker Technical College. With the hope to expand this year to 8 schools, the Swim Central program is graciously funded by Naples Children and Education Foundation. It has been established in 2012, has served nearly 12,000 children and over 91 lessons. The 10 30-minute lessons over a 2-week period are provided at no cost to 3 to 6-year-olds who are in need, as well as children with special needs. Progress is measured through a pre- and post-swim test. We also offer a robust interactive water safety webpage for families on our district website and our Water Smart Collier site. And specifically supporting our exceptional special education students and families, we have provided a virtual water safety field day with the help of Special Olympics, Parks and Recreation, and our very own communications team. We alternate water and fire safety education, including responding to emergencies, for at least the last 8 years of the middle and high school unified champion field days. Our parent and community expos and workshops that include specific water safety and swim lesson opportunities for our children with special needs. And most recently, water safety supports for families and students with autism to help address the increase for this unique population who are drawn to water. Since we need all of our parents and family members to be involved in all the layers of prevention, CCPS will look to provide an email that captures the frequently asked questions and local resources to support this call to action. Thank you to all my colleagues for the incredible work done to keep our county and children safe, and I welcome you to see all of our school samples after this conference. And I'd like to introduce Christine Hollingsworth from the Department of Health.
Good afternoon. I'm Christine Hollingsworth with the Florida Department of Health in Collier County. With the many pools, waterways, lakes, rivers, and being surrounded by the Gulf of Mexico, water safety is key in preventing drownings for visitors and residents alike. Drowning fatalities have been increasing nationally in the last 4 years. And in Florida, drowning is the #1 cause of preventable death in children aged 1 to 4. Children ages 1 through 4 are more likely to drown in a swimming pool than children ages 5 to 19 years old, who are more likely to drown in natural bodies of water. Drowning is 100% preventable. Always keep your eyes on children in and around water. This includes pools and open bodies of water. Actively supervise children, giving them your undivided attention, and never leave a child alone near the water. Additionally, proper supervision is the most effective drowning prevention. Know your surroundings and possible drowning risks at home and when you're traveling. Teach children to never be near water without an adult or proper supervision. Assign a water watcher and make sure that they understand what this designation means. Utilize barriers, locks, alarms, and door chimes for anything that has water access. And be prepared. With drowning, seconds count. CPR training can and does save lives. Whether you're a parent or a community member, Everyone plays a role in drowning prevention. Now, I would like to introduce Caitlin George, NCH Administrative Director of Emergency Services and Marco Island Urgent Care.
Good afternoon and thank you. On behalf of the entire NCH Pediatric Emergency Department team, myself, Lauren Lenti, who's the director of the Pediatric ED, and also Jose Martinez, who's the assistant director of our Pediatric ED, we would like to ask for your help to promote water safety education, especially during the summer months, when children spend much of their time in swimming pools, at the beach, and during boating activities. Words cannot express the emotional trauma that our pediatric ED team experiences when we care for a drowning victim, especially a child or an infant. We hope no family ever has to experience the death of a child due to drowning. An important step that you can take to protect the children is to learn how to provide CPR yourself. There are multiple agencies in the community that offer free CPR education multiple times a year, so please research that on websites. Also learn water rescue skills, first aid, and lastly, please call 911 to get emergent help right away. Starting CPR increases the survival rate for drowning victims. Our pediatric ED is open 24/7 and is the only pediatric ED in Collier County. Thank you for your immediate attention to this serious community need. Next is Paula DiGriguli, NCH Community Impact Director and Coalition Board Member. Thank you.
Thank you so much. 14 years ago, when we started the coalition, we learned about the stats, we learned about the cases, knowing that a drowning affects not just the victim, the family, and the entire community. That is the reason why we created a bereavement committee and a bereavement guide. And we have our friends from the NCH Spiritual Care, Abao, and Valerie's house here to provide support. And we have the bereavement guides in the table next to the 47 flowers that remind us the 47 plus the little girl that drowned in Ave Maria last weekend. As we have heard, drowning is the single leading cause of death for children ages 1 to 4. The numbers are going up, and we are seeing it here locally. So we need to do the call to action, and this is what this community is so amazing. We got together and started talking on Tuesday, and look, everybody came to the call, to come together because we can do this. We own it to the 47 and plus little girl that drowned, and the children that had drowned in Collier County. We know that drowning is a multi-sector problem, requires unity, collaboration, and partnership. Pediatricians, policymakers, educators, aquatic professionals, public health, and many other groups that touch everybody in this community. We need to educate through social media. I ask everybody in this room to please use your social media to educate the parents. We don't know what is going to make a difference. The layers of protection that the National Drowning Prevention Alliance recommends, they are imperative to reduce drowning prevention. Don't rely on only one layer of protection. Layers break down, and when you use multiple layers together, the risk of drowning is reduced. Don't just rely on a lifeguard. Don't use floaties as a babysitter. Don't think it cannot happen to you. A phrase often spoken by affected families is, drowning can happen to you until it does. Drowning happens to the good parents. Drowning has happened to good parents watching their children, and we have seen it, and we know many of them, and 2 of them are here. Paul DeMel, who lost his 2 twin boys, Josh and Christian, and Holly, Adrian. There are no do-overs when drowning happens. By practicing all layers and understanding the risk, we can prevent tragedy, and we are here to send a message to our community. We can solve this here in Southwest Florida to make sure our residents and visitors are safe around the water. We owe it to our children. We owe it to Adrian. We owe it to Christian. And we owe it to Josh. I want to take the time to acknowledge some public officials and individuals who are here with us, and thank you, the organizations, 25 plus, that they came here today to send a message to our community. First, I want to thank our speakers, Paul Hills, Captain Cunningham, Dr. Shepard, Chief Ricardo Aguilera, Tracy Boyne, Christian Holliston, and Kenley George. I want to acknowledge Collier County School Board member, Stephanie Lucarelli, Craig Trappin from the State Chief Financial Office, Jim Patron, Holly, Adrian's mom, and Paul DeMille. And then the multiple agencies that they are here in this community: NCH, Collier County Sheriff's Office, Lighthouse Pediatrics, North Collier Fire and Control, Florida Department of Health in Collier County Public Schools, Collier EMS, City of Naples, the Naples Children Education Foundation, the founders of the Winter Wine Festival, who provides multiple swimming lessons every year, Florida Drowning Prevention Foundation, who provides the funding to support Stewie the duck and also their scholarships, and they need funding. They need funding to provide more swimming lessons. The Collier County Parks and Recreation, SAM, the U.S. Coast Guard Auxiliary Flotilla, Early Learning Coalition, the Healthy Start, Healthcare Network, Goldfish Swim School, Swamtastic Swim School, the Children's Advocacy Center of Collier County, Nicholas Children's Hospital, AVAO, Valerie's House, the Wave Drowning Detection System, Collier Cares, the Safe Kids Golosano Children's Hospital, Collier Cares, and the entire team, Dr. Lopez, Cindy, from the Pediatric Critical Care, who also take care of the families and the children when they come to our hospital. And also the NICU and the nursing leaders from the labor and delivery. We cannot do it without you, and we need you. So we want to look to the cameras and say, we need your help. It can happen to you. We don't have Dover Ubers. Also, I want to take the time to thank Coral Vargas, our wonderful coalition coordinator, Haley and Sonia Vicente, our wonderful specialist navigator in Collier Cares. Thank you so much.